When you see Kawasaki children, their CRP can be up to 100 or more. And that is telling you that there's a lot of inflammation going on in that child's bed.
Today we're looking at symptoms of Kawasaki disease in children.
All right. Hi, Francisca. So we mentioned Kawasaki and I asked Francisca, have you heard of Kawasaki before? And she said, no.
I haven't.
So I said, well, in the 1970s, there was a motorcycle called Kawasaki's. And I grew up in the University of Ibadan. A lot of our medical students who are now doctors, they had these big bikes. And they used to call them Kawasaki's. And they had like 3 silencers. So they would wear, without helmets, by the way, those things. This is the 1970s. They would go on their Kawasaki's. And when you hear those bikes, they're like Harley Davidson bikes now in the US. When you hear someone riding a bike, a Harley Davidson, you can hear that bike from about a mile away because they make a lot of noise. They're very, very noisy bikes. They have sound systems that can play. You think that it's a mobile disco. And I mean, Kawasaki's was known for that in the 70s and 80s. But anyway, today we're talking about Kawasaki's, and this is a medical name for a condition that we see not too infrequently. We've actually seen a few here in Nigeria. And it's something that parents need to know about. Kawasaki is an inflammatory condition where the child gets sick and the baby's body, the immune system starts to destroy the organs in that child's body. And how do we make a diagnosis of Kawasaki's? First of all, what is the cause? We actually, a lot of studies have suggested that it could be a viral infection, but the honest truth is nobody's 100% sure. So when a child has Kawasaki's, they usually present with, first symptom is fever. Oh, my child has a fever, and this fever can be very high. You're talking about fevers that can go up to 41 degrees centigrade. So you're talking about really high fevers, 103, 104, 105 fevers. And then the child gets extremely fussy. And when you see a child with Kawasaki's, you do not know that it's Kawasaki's because you think it's a normal childhood fever. So that child usually will have a fever going up, down, and the fever just doesn't go away. Most fevers last 3 to 5 days, 3 to 4 days. In Kawasaki, the fever is still raging 4 or 5 days later. So there are certain symptoms that we look for when a child has Kawasaki's. So the fever, usually very high fever, is lasting more than 5 days. 5 or more days of fever is suggestive of Kawasaki. The other symptoms they might have is red eyes, where they have like redness of the white part of the eye with no discharge. They also will have mucositis or inflammation of the membranes of the eyes, the nose, and the mouth. So you look inside their mouth, they have what we call strawberry tongue. You see how strawberries look when it's red with the dots? Kawasaki children, their tongues look like that, like strawberry tongue. And then they could have very red throat. Some people will say, oh, it's strep throat. You do a strep test, it's negative. Streptococcus is very common in the throat. And it can cause strawberry tongue too. But with strep, we check a test, and usually the strep culture or rapid strep test will come back positive. Kawasaki's, they're usually negative. Now, they can also have rashes, like a sandpaper, very fine. Papilla means bumpy. They have a fine bumpy rash around their necks, and that can spread through their whole body. Sometimes the rash is raised, like pimples, or sometimes it's flat, or most times it's usually flat and raised from the head. It usually starts around the neck, goes up to the head, goes all the way down their body, and it's on their torso, their extremities. Sometimes it's itchy, sometimes it's not. So now I've talked about the fever, which is usually very high, lasting 5 or more days. I've talked about the redness around their eyes. I've talked about strawberry tongue. I've talked about rash around their necks. And the other thing they could have, if you check their urine, they have white blood cells or pus in their urine, which is what we call sterile pyuria, because they wouldn't have bacteria in their urine, but they have pus in their urine. And those children can have enlarged lymph nodes. So the lymph nodes around the neck, which is called the cervical lymph node chain, can be inflamed. And those children are extremely fussy and very miserable. When we do blood tests, usually their white count is very high. Some of our, there's something called a CRP, which is a C-reactive protein. That protein goes up when there's an acute inflammation in the body. C-reactive protein usually is less than 0.5. That's normal. When you see Kawasaki children, their CRP can be up to 100 or more. And that is telling you that there's a lot of inflammation going on in that child's bed. Now, the other thing it can do is it can affect the coronary arteries. What are the coronary arteries? These are the arteries that supply blood to the heart muscle, so your heart can pump. Kawasaki's can attack the coronary arteries where the coronary arteries now start to dilate. And the arteries have like multiple layers. You have muscles in the layers of the artery. It can actually dilate and open up the walls of the coronary arteries and decrease blood flow to the heart muscle. So when children come in with Kawasaki's, doctors need to be extremely vigilant of all these symptoms that I've talked about. They talk about having 5 criteria, major criteria, minor criteria. The bottom line is if you have a fever, or your child has a fever with a rash and is extremely fussy with a high white count, make sure your child is taken care of by a specialist. Ask the doctor if your child could have Kawasaki's, especially if they have a high fever lasting more than 5 days. Now, most times we've seen a few Kawasaki patients here in Nigeria, and we had a child who had Kawasaki's, and we started antibiotics thinking it was a bacterial infection. So we started Rosefid, 50 milligrams per kilo every day for 3 days. That child wasn't getting better. And it was in a series of a few weeks, we had another child who had the same exact symptoms. So what did we do? We started with antibiotics. And at the end of the day, these children, they need to be monitored very closely in the hospital because of the cardiac part of it. If they cannot have enough blood supply to their hearts, they will start having symptoms of heart failure. So these children need to have an echocardiogram. So first of all, they have all these symptoms. You will diagnose them by the time it's 5 days out. You can diagnose them even before. Because we had a child who had the symptoms and it wasn't 5 days. And the family was like, we're going to England. I put on the discharge summary or the transfer summary. This child seems to have Kawasaki. And this was on the 3rd day. The child gets to England, and the British hospital where the child goes, they're like, how did that doctor know that this child had Kawasaki's? Because they said, we can't make a diagnosis until 5 days. In the US, we see it all the time. And we make the diagnosis. So the family said, well, the doctor is US trained. But even here in Nigeria, people are making that diagnosis even before day 5. Now, as they went to England, and as our patients that we see here coming with these symptoms, what is the first thing we want to do? We put them on aspirin. When they're on aspirin is the only time in pediatrics we give aspirin is where they have Kawasaki. Why? Because aspirin can affect the liver and cause Ray's syndrome, which can destroy the liver. So we don't give aspirin apart from to children who have Kawasaki's in pediatrics generally. So moms and dads, no aspirin for your child unless they be diagnosed with Kawasaki's disease. So the first thing you want to do is put them on aspirin. And then the second thing is to want to make sure that they're well hydrated. So you do IV fluids. So the aspirin controls the fever. The other thing is we need to do an echocardiogram. We need to do an extensive workup as if the doctor will check blood work, urine. The child has to have an echocardiogram and an EKG. EKG will be the tracing of the heart to make sure that the heart muscles are getting enough oxygen, especially if you're worried about the coronary arteries, which are the blood supply to the heart, getting involved with Kawasaki. That's the worst thing that can happen. If there's a coronary artery aneurysm, which is what I just described there, where the arteries now get dilated and then there's no blood going to the muscles of the heart. So they do an ultrasound of the heart, which is called an echocardiogram. You do an EKG, which is the tracing of the heart, the electrical conduction of the heart. You want to make sure that the heart muscles are okay. Most times, usually it's fine. But then, because you do an initial echocardiogram and an EKG and it's normal, they need to do another one at 6 weeks, because those symptoms can show everything is normal in the first week of the illness. But 6 weeks out, you need to repeat it, and then the EKG and heart ultrasound will be done on serial times, depending on what the cardiologist says and what they want to do. So after we give them the aspirin for the fever, we give them IV fluids if they need it. We also need to do all the tests that are needed. The white count will be high, most times CRP, which is a CR-reactive protein, will be high. Usually the blood cultures are normal. There's nothing growing on the blood culture. That's because we don't really know why the body is fighting itself. So when there's a lot of inflammation, that means there's a lot of antibodies in the body where your body has developed soldiers. that are killing the muscles of the body. What do you do to knock up all those soldiers, the antibodies in the body? You need to give children IVIG. What is IVIG? It's IV immunoglobulins. Basically, it's proteins that you introduce into the child's body by IV, and it goes and mops up all those antibodies or soldiers that are destroying the child's immune system. Just destroying the child's body. So it's kind of like you have a war going on in your body. You have soldiers killing yourselves for no reason. These are not soldiers these are not enemy soldiers. These are your own soldiers kind of fighting you. You have a house, your soldier is trying to destroy the house that you're living in. So it's almost like robots that are out of control. So to stop all those antibodies, you have to introduce IVIG. The immunoglobulins go in and bind to the soldiers, the antibodies, and stop the antibodies from killing your cells. So some of these children can even have kidney or liver failure or liver injury or kidney injury just because of this Kawasaki's syndrome. So once the children get the IVIG, they also sometimes they're put on steroids. Steroids help to decrease the inflammation that's going on. And these children usually tend to get better over the course of 2 to 3 weeks. Sometimes the skin rash can now become discoloration because the body has attacked the skin cells. Also, what's the biggest organ? When the skin. Next when you see these children sloughing off like skin, like there's no tomorrow, and that's all part of the body trying to repair itself, especially after you mopped up the antibodies that is destroying the child's organs. So once you have all that healing and the fever has stopped, and then eventually the blood work now becomes normal, the C-reactive protein, which is a marker of inflammation, starts to go down. Basically, your treatment is to decrease the inflammation in the body. Once you decrease the inflammation, knock up all those soldiers, destroy the child's body. The child usually should get better over the course of, sometimes they can take up to 6 weeks to get better. But they need to be monitored very closely, because if it's not monitored closely and children become dehydrated and the inflammation goes unchecked, anything that happens, and some of these children can actually die. So parents need to be aware of the fact that there is something called Kawasaki syndrome. We don't know the cause 100%. Many people postulate, or there's a hypothesis that it could be viral, where the virus turns your body against itself. But you always need to make sure that you see a good pediatrician or a good doctor to get the child checked out so that they can get the care they need. Sometimes they need a blood transfusion because there will be, the body has, the antibodies will attack the red cells in the body and decrease the child's blood level. They need to increase oxygen carrying capacity by giving a blood transfusion so that there's enough oxygen going to the brain and the vital organs of it. So that's really Kawasaki's in a nutshell. And I know it's a bit hyperphenytic, but if you have a child who's had a fever and rashes and is not getting better, and the fever is more than 5 days and it's extremely high, take them to your doctor and ask them to check your child to see if they have Kawasaki's. And that could be a lifesaver for the child.
Oh, thank you, Dr. Sanusi. That was really enlightening. Like, I didn't even know about Kawasaki until today, and watch out. So see you all next time. Thank you. Bye.